Aye.
He wasn't supposed to, but he thinks he was here.
We'll get it figured out.
Good morning. Could you please stand and join us for the flag salute? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good morning, everyone. Happy 2026.
Good morning.
Could I get a motion to approve the minutes of the Monday, December 29th meeting as written?
I'll move.
Second. Been moved by Peterson and seconded by Barker. Any further discussion? All in favor say aye. Aye. Motion carries. I'd also ask for a motion to approve the minutes of the Wednesday, December 31st, 2025 meeting as written.
I'll move. Second.
Moved by Peterson and seconded by Abendroth. Any further discussion? All in favor say aye. Aye. Motion carries. All right. Miscellaneous motions. I would make a motion to authorize and direct the chairman to sign 7 tax abatements in the amount of $17,317.90.
I'll second that.
McCurry has seconded it.
I just want to point out, we're losing valuation because of this dumping next to a property. If you guys go through there and look at 707 on Matt Fisher and Jordan Fleming, value change due to dumping site of industrial waste west of house.
That's the injection site, or
Yeah.
But on this, we're starting to lose revenue now because of it.
right.
But we're doing everything we can to stop
I
it,
know, but we need to continue to work at
and
it.
we
Right.
are.
Yeah.
Yeah, because I had a complaint about it this weekend. They were turning around on somebody's
I mean,
property.
it's not the fact that we haven't, that we've quit trying to do anything.
I know that, Steve.
I mean, we're still working on it.
And it just keeps dragging on and on.
Yeah,
At least it sounds like it got limited.
limited a lot.
There's a lot of limits.
Yeah.
We still need to
That's
stay on it.
Yeah.
Right.
It's good to point it out, though.
Yes, sir. Okay. Any further discussion? All in favor say aye.
Aye.
Motion carries. Go ahead and do this next one.
Yeah.
Ask for a motion based upon the recommendation of the county clerk and approval of the county attorney as to form to waive the purchasing policy as to competitive bidding for good cause, said cause being that the vendor is a single source supplier contract, and to approve annual peopleware agreement and support January 1st of 2026 through December 31st of 2026 for CIC, which is Computer Information Concepts Incorporated, Greeley, Colorado, in the total amount of $46,820. Funding for the purchase will come from the General Fund Courthouse General Contractual line item. This is for our financial system, and the motion is made annually. This is an increase of $790 from 2025.
Make that motion.
I'll second it.
Been moved by McCurry and seconded by Peterson. Any further discussion?
How many years have we had CIC? It's been quite a few years.
I know it's been over 26 years.
So,
way
a long-
over.
A long time.
Yeah, to find a financial system that can handle governmental accounting is difficult to do. QuickBooks doesn't work for governmental accounting. So in Kansas, this company, they also have offices and support in Goodland, Kansas, that they work out of for Kansas. The main company is out of Colorado, but
Okay.
All right, thanks.
Okay. Any further discussion? All in favor say aye.
Aye.
Motion carries. Go ahead and do these others, the payroll notice. Motion to authorize and direct the chairman to sign the CP2 payroll notice for Casey Perry from tax/levy clerk to payroll/benefits coordinator. Promotion from wage classification 40-12 to 40-21. From wage of $26.71 to $30.30, effective 12/16/2025.
So moved.
I'll second.
Been moved by Abendroth and seconded by Peterson. Any further discussion? All in favor say aye.
Aye.
Motion carries.
Are you ready for?
Okay, so I guess we are ready for Hospital Administrator Stacy Augustine update. Good morning. Looks like we've got Eric here with us too,
Yes.
Eric Urban.
Here as well. Happy New Year.
Thank you.
Thank you. Thank you. Thanks for carving out some time for us this morning. I'm not here to provide a 2025 update just yet. We're still wrapping up all of those numbers, but in February or March, I'll be back again to just give you an overview of how 2025 was for us. But I did want to get in front of you guys early on to talk about the shared service agreement that was recently announced with Newman Regional Health, and just kind of address maybe some of the concerns or questions surrounding the agreement, and just go over what that agreement means, what it doesn't mean, and then cover some of the benefits as well of this new agreement. So essentially this is a lease agreement, which I think we've talked about a couple of times before, as far as leasing a provider from another facility. That's truly what this agreement is. It's two hospitals that are sharing a general surgeon. In simplest terms, that's what's occurring with this agreement. It will ensure that we have continued access for general surgery services here in Coffee County. And the agreement allows us to have that general surgeon 2 days per week. It does also allow for potential growth. So as that general surgeon is here, if we see that our volumes are higher or we have more needs, we can go back to the table and increase the number of days of coverage that we would need. We will have one primary general surgeon that provides services here. His name is Dr. Landry. He's wonderful, very personable, very in touch with rural health, some of the limitations with resources and things like that. I think he's going to fit in well. All of our providers have met him and feel very confident and comfortable with the services he'll be providing. Although he'll be our primary general surgeon, we will go ahead and credential and privilege the other general surgeons at Newman Regional Health as well. And that's just in the off chance that maybe he's out, or if something occurs and we need another general surgeon, then we already have them through all of the paperwork process for them to be able to provide services as well. I think one of the biggest concerns comes down to insurance. So I want to be very clear that with this lease agreement, anytime the general surgeon is at Coffee County Hospital, they're truly a Coffee County Hospital provider. So we will bill for all of their services that they provide. So any insurance that's accepted by Coffee County Hospital, if you're receiving services at Coffee County Hospital by our general surgeon, it will be covered as long as we are in network with that insurance. And then vice versa, when they're at Newman's, they are a Newman's provider, so any insurance there would be accepted through Newman's. So what this agreement does not mean, it does not mean a merger or acquisition between the two agencies. I want to be very clear, no merger, no acquisition. And of course, that would be beyond my scope of decision making, and you all would be involved with that, any decisions like that. And neither one of our organizations have any interest in doing that. So truly just two hospitals coming together to collaborate to figure out what is financially best for both, as well as best for both communities. We will also be using our own surgery staff. So we currently have a team of 4 nurses in our surgery department. We also have our own anesthesia providers through a group called CCI. They will continue to provide services alongside the general surgeon. So there's no additional support staff that will be coming from Newman to provide those services, with the exception here of the first couple of weeks. His nurse will be coming with him just to ensure a smooth transition into Coffee County. The big benefits of the agreement, of course, it's financially favorable for us as well as Newman Regional Health. The overhead cost of employing your own general surgeon is quite large. It of course goes beyond just the salary of the general surgeon. You have all the benefits, retirement, health insurance, medical malpractice insurance, which is a pretty hefty cost. And insurance, they don't care if they're part-time or full-time, it's the same cost regardless. So that's a big overhead expense as well. And then also taking into consideration paid time off. That is time off that you're still paying for the general surgeon, but no revenue-generating services are occurring in the facility. So with this agreement, we pay a flat rate. It's $2,400 a day, anytime that the general surgeon is here providing services. So that amount, how we came to that amount was we took the general surgeon's salary, which is based off of NGMA's salary scale at about the 50th percentile, divided that over the number of working days in a year, and then we also allocated an appropriate percentage of medical malpractice insurance costs and things like that to get our daily rate. And we only pay that rate when the general surgeon is here providing those services. So it makes it much more financially feasible for us to provide those services. Also helps Newman's to reduce some of their overhead expense as well with employing general surgeons.
So all of the insurance will be covered through Newman?
As far as medical malpractice, yes. Mm-hmm.
Okay.
Correct.
Okay.
Yep.
So are these surgeons employees or are they private contractors? I mean, like all of his employee benefits are through Newman.
That is correct. Yep.
Okay.
Mm-hmm.
Okay. Didn't mean to interrupt you. I just
No,
wanted to
that's okay.
ask that while I was thinking
Yep,
about
no,
it.
that's a great question. And with medical malpractice insurance, they can only have one plan.
Okay.
One entity has to cover those.
Okay, so we're reimbursing them basically for that.
Yes, yeah, the
subsidy.
percentage of days that he's with us, correct. And so right now, we have several outpatient specialty providers that come down from a variety of locations. We have urology, ear, nose, and throat, OB-GYN, cardiology. They all are a similar agreement in that, their medical malpractice insurance is covered by their home entities as well.
Okay.
But there's some split billing that works with those particular outpatient talks. Of course, this ensures access to care for our community and for our patients. And one of the things that it also brings to us is in a rural environment, as you all know, sometimes our volumes are a little bit lower, and so it's hard to maintain that confidence to do certain procedures. If you're only doing it a couple times a year, you start to question yourself of, should I be doing this, can I be doing this? And so when you have a provider that's also at another facility with much higher volumes, they're routinely doing these surgeries and hopefully will maintain that level of confidence to be able to do those procedures here as well. There will be some procedures that they're just too high of acuity that would not be appropriate for us to be able to do. However, when that occurs, patients will still be able to get all of their preoperative appointments done at Coffee County Hospital. If they have any needs post-surgery, if they need, a stay in a swing bed for a while for rehab, they will come back to Coffee County for that. So our goal is for patients to not have to travel whenever possible, and of course to maintain those volumes at Coffee County Hospital. So the decision-making process as far as how did we decide to ultimately go with Newman's for this agreement. We have previously done some collaboration with Newman Regional Health as far as our electronic medical record system. As far as proximity goes, they are the closest to us. And then we did look at a couple of other larger facilities of, could we get a surgeon from another larger facility, and that's always an option. But there were a couple of downfalls that I would say with doing it that way. One being we had previously used a group out of Topeka. They were absolutely wonderful, had great outcomes, great quality care. The biggest complaint that we heard from the community is that the general surgeon that they were seeing for their pre-op appointment may not be the surgeon that's actually performing their procedure. And in our town, we have found that you want to sit in the office and you want to see that provider, and then when it comes time for your surgery, you want it to be the same provider. And so Newman's was able to offer that, which was an added benefit with going with them. The other piece with larger facilities, they weren't able to offer us the level of access that Newman's was. Most other facilities, it was a couple times a month versus a couple times a week. And we felt like our volumes are high enough that we need somebody on a weekly basis. As far as quality of services and outcomes, he has went through our credentialing process, which is a pretty stringent process. So we look at all kinds of quality data to make sure that the providers that we are bringing in are providing high quality care with good outcomes. And we will continue to do that as they provide services. As far as the model of care, this really isn't anything new or unique necessarily. The uniqueness of it probably comes from two critical access hospitals working together on it. Generally, you'll see a larger tertiary facility helping out with a small rural facility like ours. And instead, two critical access hospitals are working together. And I do see that probably occurring more and more with the rural health transformation funds that were just awarded to the state. We don't have a whole lot of detail yet of what that's going to mean, but I do anticipate we'll start seeing more and more of this around our state with smaller facilities working together. As far as the contract details, the term will expire in 2028 at the end of the year. However, there is an out clause with 180 days notice. So if we get into this and ever discover, hey, this wasn't the right choice, or we want to go another direction, there's always that opportunity. I have full confidence that this is going to be a great move for us. I think Dr. Landry is going to do a wonderful job, and I'm confident in this decision. But with that, I just wanted to open it up for any questions that you all might have regarding this agreement.
Since you and I talked a little bit about Coffee County insurance, and you said if there was a special situation that Coffee County couldn't handle here, and the patient needed to go somewhere else, would they be able to see that surgeon in Emporia?
So, potentially. So, our credentialing processes are different as far as payers go. So there is potential that we could potentially have an agreement with an insurance that Newman's does not. So if they were to need a procedure that we're not able to do, and they, as far as going to Newman Regional, if their insurance is not accepted, the patient can always go there. It comes down to patient choice. The patient could always go there knowing that their out-of-pocket expense is going to be much higher. However, just because we have this agreement with Newman's does not mean that we can't make a referral to Topeka or to KU Med, wherever else that may be. So we'll assist the patient in making sure that wherever we're sending them, that we'll make sure that their insurance is in network for them.
I guess I'm trying to say that they've been dealing with this surgeon, and all of a sudden their insurance won't cover them in Emporia, and they go to Topeka. They have to have a blind surgeon to do it. That's what I'm kind of getting at.
Gotcha. Yeah, I understand. Potentially. So it's twofold. Most of the time, especially if it's a procedure that is such a high acuity that we're not able to do it here, the general surgeon will want to see them in their office. Our providers are pretty aware, our family practice docs are pretty aware of what our capabilities would be here. So if we already know that it's something that we're not going to be able to do at Coffee County Hospital, we would probably go ahead and refer them to a larger facility ahead of time. But we'll do everything that we can to make sure that the process is as smooth as possible for those instances, because insurance is an ongoing, constant, frustrating battle for a lot of people, and we sure want to make it as easy as possible for our patients and community. Thank you for asking that. I appreciate it.
And I got one other. With all the negativeness that's going on social media with Newman Hospital, and then the possibility of Stormont coming in, how does this affect anything that you're doing? Or are we going to lose a surgeon that goes somewhere else? I mean, it won't be tomorrow, and it won't happen by the time that you're saying the end of this contract. So, but is that potential or not?
I think the potential is, you never know.
I know you don't have a crystal ball.
Potential is always there. I do know with Stormont Vail moving in that they have said that they will not do surgeries there for at least 5 years. Now, if they ever decide to do surgeries there, that will be a direct competition with Newman Regional. Will that have an impact on us? Potentially. It kind of depends on what would happen with Newman providers, if they have to make some changes or not. But it's difficult to say at this point. Anything else I can answer for you all? Eric, anything that you wanted to add?
No,
being here. Okay. Sounds good. I will be back in February or March to...
Do you have any idea how much federal money we're going to be receiving for rural hospitals that the Trump administration is talking about?
For the Rural Health Transformation Funds, So Kansas was awarded a very large amount, more than we expected. I think we were either fifth or sixth with a large amount, which is a blessing in that we will receive that money, but also a curse because it probably tells us that Kansas hospitals are struggling more than others. The money will not come directly to facilities. So there is a plan. It is publicly posted, and actually I'll send it to you all in an email of what Kansas has outlined with what they would like to do with the money. None of it comes directly to facilities, but goes more towards programs to support rural facilities. I'm unclear right now if when CMS reviewed that application, if they approved the application and all initiatives within the application, or if there are certain initiatives that were approved. So I'm still waiting to hear clarification on that. I know there's some meetings coming up in the next couple of weeks with the powers that be at the state, so I should have a good update for you when I come back in February regarding that.
So that decision will go, what department at the state? I mean, I'm not familiar with that.
Yeah, so Governor Kelly put together a group of folks, if you will. The KU Care Collaborative through KU is the primary gatekeeper of the program, it looks like. Now, they actually won't have the checkbook to write the checks, but they will drive the programs, and then the state will fund those programs.
Okay, so that's who's going to be working on that, probably.
Yeah.
Okay.
That money will trickle down, what you're saying, and eventually.
It will trickle down, yes, it will trickle down to various programs, which will then offer support to rural facilities. Yeah, but we won't actually see a check written out to us or anything like that, but.
Yeah, the way it came out first, why it sounded like
I know.
it was going to have that effect.
Yeah.
Where you would get a check as far as a rural hospital.
Yeah, and that's not the case, but I am hopeful. They have some great things lined out in the application, so I'm just curious to see what will be funded and then how we'll move forward from here. So, great question.
Thank you.
Hey, thank you.
Thanks so
I
much.
appreciate
Thank
it.
you.
Thank you.
Thanks for the
Yes,
update.
absolutely. Thank you.
Okay.
Yeah, that's a question earlier. I'm not here to talk about this. Call me in if you have a gap. But it was mentioned, hey, what money do we have where, and what interest we're making. There you go.
Okay, thank you.
Thanks.
So if you need me to find a gap, I can go.
Okay, thank you. All right, Sheriff Tom Johnson, federal application. Good morning, sir.
Good morning. So it's been submitted, finally. They finally allowed us, gave us the okay to get that started and gave us the link to get it done. So, it's advantageous to be on the top of the totem pole because I made Eric do it. So no, Eric did it all. Eric finally got it. It took a while to get it because they believe me. We put your children's Social Security numbers on this because they asked detailed, explicit information. Luckily, Angie was able to help us on some stuff. We had to call EMC to get us some specific stuff because we couldn't say, 1.7 million for the courthouse. It had to be for the jail side, sheriff's office, that building. So we had to do some breakdown numbers. We finally got it completed. And last Monday, when Angie called and asked if I could come here and talk to you about it, we got notification by email that it was accepted. So the paperwork that Eric got sent in did get accepted. Of course, it says now they have 120 days to go through it, tweak it, ask other questions or whatever, but it has been accepted. So they accepted the way we sent it. We don't have to, go back and tweak something. So now we're waiting again for them to truthfully go through it, look at it, and then they told us up to 120 days for the next step. So the next step is going to be what's the word I'm looking for? The process of, okay, you're telling us that you're going to do this for $68.50 or $75 a person, whatever. There can be negotiation, yes, of dollar figures. But what we're being told by the other agencies, if you're somewhere around $70, you're going to get accepted.
Okay.
The reason we didn't say $90 or $100, we kind of chose that. And again, Goldberg told us originally 6850 was the lowest mark we want to try to go to. So again, we're waiting. I don't think it took them 4 days to tell us that we were accepted. I don't expect it to be 120 days, but again, I'm not the federal government either.
Right.
So we're just sitting there waiting. So Wade said, he told me we met for, I don't know, lunch that afternoon or something. Said you guys were also inquiring or maybe need to give an update on what it cost us to run that jail for the last 6 months. To give you an update. Whether that came from you or whether it came from Wade, doesn't matter. So it cost us $532,013 to run jail, sheriff's office, or whatever for the last 6 months. So when we talked about from the beginning, you know, Larry talked about it being right at $990,000, almost $1 million. You know, is what they talked about from day one. That's pretty damn close. Pretty close. And that's without any inmates coming in. We're averaging 26, 27. We've had as many as 41 in the last 6 months. We kind of went together and asked Woodson County, doing some inquiry about, hey, who could we get in here close to be advantageous for them? We had the undersheriff and sheriff come up, took them out for lunch, showed them our facility, talked to them about our medical facilities, blah, blah, blah. And so we're housing Woodson County inmates now. It's easier for them instead of having all their women taking Iola and their men here, and they only have space for 10. And their facility is obviously not as secure as ours is. And so we talked to them, showed them the facility, and they said, hey, we'd like to start bringing inmates up. So we're starting to do that, trying to get some people in here. So other than that, that's pretty close. Pretty close, $532,000.
Okay. So Eric sent in a application to receive inmates in, correct?
Correct.
So the first step, I think, Tom, was you had a federal marshal come in and...
So that will come in this next phase.
Oh, that's the next phase.
That's the next phase,
Okay.
and once they approve it, and
I
they
see.
say, you know, you're gonna do this for $6,850, then they're gonna come down and physically walk through
And
our
that's when
facility.
they'll do the inspection or whatever.
That's correct.
Fine.
We've had a number of conversations with the U.S. Marshal out of Kansas City, Ron Miller, and really it's just been a when can you get to it kind of conversation with him multiple times. Finally, I think we got the fire lit and got it going. Whether it was the government shutdown or ICE or whatever their excuses were, they kind of ran out of them, and here they come. So it worked out after all of that.
It wasn't we weren't trying, we physically, personally talked to Ron, and said, hey, you know, come on. And he said, you're on the list, you know, Tom, Eric, you're on the list.
Right.
When the president says you're gonna focus on ICE detainees and the ICE problem, we focus on the ICE detainees. That's what they told us.
Sure.
So, yeah, we're just, again, it's bad to say we're playing the game. We're playing the political game here, when we can get set up, so.
So how does that work on down the road, Tom? Like now, you set the 6850 for now, then is that annual or something, because of cost,
Absolutely.
what time would you be able to renegotiate that, or?
The way I understand it, it's a yearly contract.
Okay.
Yeah, that you can yearly, discuss with them. So-
It is a separate process to do the renegotiation.
Yeah, that's what I'm wondering, when that could occur, if you decided that everybody else is going up, if everybody
Yeah.
else is higher, then you're like, we don't want to be left behind, we want
Right.
to, obviously you guys want to get all the income off of it you can.
Right, absolutely.
They allude to the idea that it's going to be, you're going to have a significant reason for why you're changing your costs once they negotiate it, but they're willing to listen.
I see, okay.
And like I told you before, that number depends on what you're gonna do for them. If you're gonna go to Kansas City or Springfield or Wichita and pick up prisoners, inmates, and bring them back, that's a check mark on the box, and instead of the marshals bringing them to you. If you're taking them to their doctor's appointments, that's a check mark. If you have a facility in your building for medical, that's a check mark. And the more check marks you get, the more you can negotiate for it. If you say, hey, we're just Motel 6 and keep the light on for you, you bring them, you send somebody down to get them taken to their appointments, they're not going to give you as much or offer you as much. It's how many check marks you can put on the box.
But your plan would be that you would go pick up inmates in the proximity?
Absolutely, we're gonna do whatever we can. We've got those, extra guys at the courthouse courtroom security that have been doing our transports.
Okay.
When we don't have court, or it's a short court day, then we schedule them. And so, like we've said, let's just say that Johnson County picks up somebody on our warrant. You know, we have a time limit that we can go get them. And we're not gonna go get somebody in the middle of 4 days of court. You know, so
Right.
we've said, hey, the days we don't have court, whether it be a Monday or a Friday or whatever, that's when we're gonna do our transports. So Mike Tweed has been very good. He's my sergeant there in charge of that. Mike's been very good about saying, hey, I can go on such and such day, and which they do the same thing for us, and we do for other agencies. We work with other agencies. You can't send somebody to spur of the moment to come get us at midnight. We don't expect you to.
Right.
We'll see you at 10 o'clock next morning, you know, so everybody's working with us, and we think that they'll work with us too.
So they're held there wherever they're at until?
They're held there until we can get up there, yes. Normally, we have 10 days to go get them. So
Okay.
sometime in that 10 days,
Oh, yeah,
you know, we've got an opportunity to get somebody loose to go get them, so.
okay.
None of the application that you guys are talking about at the federal level affects anything in the transfer in-state, does it? Where you take somebody in?
I understand that.
Like from another county.
Oh, no, we got plenty of space.
Okay, I see where Cloud County's advertising for people they're trying to repopulate other jails with their jail personnel because they don't have the staff to maintain the jail.
That's always a concern. There's many agencies. Let's talk about Bourbon County, Fort Scott. So at one time, Bourbon County Sheriff calls agencies around and says, I've got 43 inmates, I need them all out of here. I only have 4 jailers. And, you know, you need to have probably a 4-to-1 ratio. So he took every inmate he had and got them out. And told the commissioners, you know, I gotta do something different here. I gotta raise jail wages to get people in here to get hired so I can get some inmates in. You know, talk about waking up some commissioners that were not, you know, receptive to the sheriff. You're not making money, it's costing you how many thousands of dollars. We went through that, you know, when you're housing people out because you only got beds for 18 inmates.
Yeah.
You're paying for somebody else's facility. You know, Sheriff Friend over in Lynn County said, I hope you don't get this built, Tom, because you paid for my facility, you know. Yeah, he was giving me a hard time. Hey, I don't want you to build it because, you know, you paid for my facility all these years, so.
And then getting shipped up there.
Yeah, so it's a tangled web we weave when it comes to making sure you have plenty of people. Because if you can't, then the feds are gonna say, listen, you aren't set up to take care of us. And again, if you only have that many, don't talk about federal inmates. It's my responsibility to take care of the 23 I have in jail right now. How can I do that with two jailers? Thank goodness that we don't have only 2, we have plenty. But I'm just saying, you've got to have the right ratio, or it's a danger to you and danger to inmates. So, that's where we're at right now.
And since we've been over here at the new facility, we've had as high as 41 inmates.
Yeah, 41.
And, as well as, 19, so.
Yeah.
Just kind of fluctuating. Try to put an actuary on that, good luck.
Yeah.
Have you guys settled into the new facility yet, or are you still having hiccups?
Our biggest concern right now is the heating and the air conditioning. We have a constant, have you checked today, see if the air TUs are up?
I haven't yet. We're thinking about sending somebody to HVAC school, so.
Yeah. So
I agree.
it is a constant issue. So for example, let's talk about, in today's world, everything is computerized. So this HVAC system, air conditioning and heat, is all on a computer that we have access to, that we can make changes to. It'll be cold or hot. Let's just talk about cold, wintertime. Let's talk about you have some rooms that are cold. Maybe the jail, a pod that's cold. And you'll start looking at this computer and you'll say, well, it shows all the systems up and running. But it's not. So we have to physically go up on the roof to the RTU units, and maybe it's kicked a breaker. So it's not talking to the computer. So then we have to manually reset breakers for the system to kick on. Then you go downstairs, and you'll see it. Okay, in a few minutes you can see that it's starting to warm up or whatever it may be. So you call McElroy's to come in, and they say, Yep, we'll see about that breaker. It's not it's not a bad breaker that's tripping all the time. But what that system does is we're heating with water. You know, there's coils up there that the air blows through, and that warm water heats up the air.
You have to have a boiler working.
Yes.
In order to get air conditioning or heat, by the way.
Yes. And so once you get that RTU fixed, and then something's not working, then you have to go check the boiler systems, because the boilers may have kicked off. So then you have to go check on that. So there's been an issue with this, the boilers have filters on them, little bitty filters. And these filters are getting clogged just from debris, from the outside, you know, into the building. So you go in and you have to physically take these filters off and clean them, put them back in, and the system will work. And we've spoke with McElroy's, and they're going to try to put some type of filter system before this that will keep us from having to check weekly whether these screens are plugged. So, thanks for bringing it up, but things are now screwed up probably since we're up here talking about it. It was working as far as we knew when we left, but we'll go back downstairs and somebody will either be cold or...
To be clear, we have 2 of those boiler systems over there, and one of them is not having a problem. So this is not a city water issue. We've discovered that it's going to be something within the system on the south end. So, we investigated that some.
Yeah, we've done our own. We had a water hammer problem, what we think it is. At 8:30 every morning, sounds like roof's going to blow off this building. I mean, it would be a water hammer. Yeah. And it was so bad that we had people stationed at 8:25 at different locations.
Trying to narrow it down.
Yeah, trying to narrow where this was down. And we think we got that taken care of. But, again, just some problem solving on our part, and thanks to River City for saying, yep, we're here, we hear it. So everybody's worked on it. We've kind of taken care of that problem. But
and McElroy's and others have worked with us on this.
Yeah.
They keep talking about how they're losing money on this, but they got to keep coming back for just a little while longer and
Yeah.
get it fixed out, fixed and tweaked.
That's what we keep saying. We don't care what you like. We've got you for a year or two, depending on what what thing it is that we're having warranties on. But it's we're hoping, as you all know, it's not as easy. For example, we call them and say, hey, we got a problem. A boiler's shut. Before we knew kind of what we could do here, we'd say, the boiler's down. Okay, I'll try to get somebody there. They're not here every day, there for a period of time before phase 2 started. So then you're waiting for a tech to show up. And it may be 2 days or it may be a week. Bless you. So now that they're here, it's easy to be able to say, we got a problem, come work on it. So I don't care whether we call them 5 days a week. This is warranted. They're going to do the work and make sure it's ready to go. And we understand the new building and new problems. But we're trying to work through them. It's still...
They have been good at it.
Yes, they have.
That's a major plus.
Absolutely.
A lot of those
Yeah.
home units are really sensitive to voltage being a little low or something, but I'm sure
Don't-
McElroy
hey,
is checking out.
Be quiet. Be quiet.
Might be causing
Yeah.
it, man.
We've looked through that. We've looked at that too. So
Absolutely.
yeah, they talked about some sensors being in the wrong spot. So when air's coming in, it's not seeing that this is coming in, the outside temperature. So yeah, come on in, buddy. Have a seat. Come in with the rest of us.
I was gonna say, so now that you have about 6 months of operation expenses, whatever, in the new facility, I mean, this 2026 budget, I mean, that should be no problem. I mean, everything's budgeted okay?
So everything's budgeted fine. We gave you back this year about $700,000, just because we didn't have the number of inmates, the other 30 inmates or so, that we expected. We did some tweaking on our food service for the jail, which I'd save some money there. We didn't feel that we didn't feel the numbers were right with what was doing, so we changed. So there's been some tweaking going on, but again, whether we have 10 federal inmates or 30, we just don't know. So we're still kind of playing. We can tell you what it costs us to run it with, a max of 41 and average of 27, but we don't know what's going to
Our
cost us.
budget is set up for the maximum.
Yeah.
And
Yeah.
so, if that doesn't hit, then you'll get it back.
Yeah, we're not trying to play that game as we need more money. I've never done that since I came here. Hopefully I don't ever have to, knock on wood, to say I don't have enough money. But yeah, we're not spending frivolously. We gave you money back because we know that we're probably gonna need it next year. and the county needs it, you reimburse whatever funds you have, but we're trying to be good about it and trying to be stewards for the county, so.
We appreciate that.
Anything else, gentlemen? Speak now or forever hold your peace until next Monday.
Good luck on that next phase.
Thanks, yeah, we're trying to.
Call Cloud County up and see if they got anybody they wanna rent out to.
Who's that?
Cloud
Cloud
County.
County, yeah,
Okay.
yeah,
Concordia.
yeah. Yeah, there's a bunch of them, so. Okay, if you need something, let me know.
Thank you for the update.
Uh,
Does anybody want to take a break?
Right here.
Good to hear.
Happy New Year, so. I see you got a bill for it.
Why don't we come back?
Does it run on the wheel saw?
He says.
I
can wait a while.
That's fine.
It doesn't matter.
You get one of those.
Whatever you wanna do.
Okay, well, the next two are kind of the same guys, so maybe we can get them done. Okay, Road and Bridge, Adam Hope, equipment purchase. Good morning, Adam.
Good morning. Happy New Year.
Happy New Year.
And you too.
Yeah, I don't have a whole lot, just a couple pieces of equipment. The two bush hog mowers, that I brought last year. Originally we talked about purchasing 4 of them. We purchased 2 of them last fall, and then the other 2 we'll purchase now. So that's the first motion I've got, I guess.
Okay.
You have those in, don't you, Adam?
Yes, we have all 4 of them. They went ahead and brought all 4 of them to us, and with the understanding we wouldn't pay for the second 2 until after the first of the year. That was, Sloop got them in and wanted to bring them to us, so he went ahead and brought them all down, and right there before Christmas.
You bought 4 of them?
This was, so I've been looking back through some recent years on prices and whatnot, and I'm not too upset with the prices that we're paying now in 2026 compared to what we paid in 2006. We still have one that we bought from Caldwell's that was about a $16,000 bush hog 20 years ago. So I'm not overly upset with the numbers,
With the current pricing?
with the way the world works these days. Yeah.
Okay.
Yeah.
Well, I'd ask for a motion based upon the recommendation of the Road and Bridge Supervisor to waive the purchasing policy as to competitive bidding for good cause, said cause being municipal program pricing with Sourcewell Government Purchasing Alliance with Coffee County number 118463, and to approve the purchase of 2 2025 Bush Hog 4115 15-foot flex wing rotary cutter, sloop sails, and hooks repair, Linden, Kansas, in the amount of $53,100, and to authorize and direct the Road and Bridge Supervisor to sign all documents related thereto. Funding for the purchase will come from the General Fund, Public Works, Equipment line item.
I'll move.
Been moved by Peterson and seconded by Barker. Any further discussion?
I will say, we've got quite a lot of mowers that are 2012 and older that will start cycling out. Maybe keep one around for a spare, maybe a couple, but we'll start getting rid of some of this older.
What's a lot?
A lot as far as numbers.
So we have a lot.
We have
numbers,
12 total bush hog mowers, and that's 8 section blade guys mowing. Usually 2 to 3 mowers running on asphalt
Right.
throughout the county, and then usually 1 spare sitting around just as a life jacket, I guess, so to speak.
Okay. All right, any further discussion? All in favor, say aye. Aye. Motion carries.
Thank you.
You're welcome.
This next one is something that we've looked into for a couple years here. We do a lot of right-of-way clearing and our intersection site triangle clearing. Take a lot of tree rows and hedgerows and whatnot out. And this mulching head that goes on our skid loader we demoed here a week or 2 ago, and the amount of time that this machine saves us not having to be on site with the track hoe trying to pull all that grubby, shrubby stuff out, and the appearance that it leaves. I got some pictures here just to show you some before and afters.
Did you do this on
Yes.
22nd? It looks really good.
That's the first group of pictures that we did some stuff. It chews it all up. It's basically toothpicks when we get done, and the efficiency of it, it just cuts down the time for,
You guys weren't there very long at all.
I'd say, a couple hours.
Yeah.
And, I've sat out there in a track hoe many a times trying to pull, little plum thickets and buckbrush, and it's just kind of frustrating, so.
You end up
It's
dragging
texture.
all the dirt up with it.
Right, that's about what you have to do. You gotta put the tooth bucket on and get down and take about 6 inches of dirt and get all the stuff cleaned up and then put the dirt back, so.
Try to sort the dirt back, right?
Yeah, been there, done that, so.
Yeah.
That's, like I said, we demoed this exact model there a few weeks ago, or a couple weeks ago, and, so it's basically a gently used, it almost looked brand new when we got it down here from John Deere. Basically a new used demo model is what this is. And my John Deere rep, he tells me that it will basically chew anything up 14-inch in diameter and smaller.
Wow.
But that make things vibrate a little,
Unfortunately, I personally didn't get to run it. I wanted to, but it's got carbide teeth and 60 inches wide, and I have ran one similar a few years ago, and they. I know why it says stay back 100 feet on the front of it.
300 feet.
300 feet, sorry, yeah.
300.
Stay back a ways.
Stay back. Would be the-
And then I've got the quote here if anybody'd like to see it from John Deere.
Well, just looking at these chains and the drum and everything, it doesn't look like it's been used very much, really.
No, and I actually, I checked the used market, and this exact model on a lot of equipment websites was 32-ish to 38,
On a
used on a used one.
on a
Wow.
used one, I see.
Found some of them that were around this same price or a little bit, a couple $1,000 higher that were well used.
Okay. Well, I've asked for a motion based upon the recommendation of the Road and Bridge Supervisor to waive the purchasing policy for 2022 Diamond Mowers 25-2004 60-inch mulcher with carbide teeth for good cause due to availability. Purchase will be from Murphy Tractor and Equipment in Topeka, Kansas, with a purchase price of $26,500. Funds to come from the General Fund Public Works Equipment line item.
I'd make that motion. And I'll second it.
Then moved by McCurry and seconded by Abendroth. Any further discussion? All in favor say aye. Aye. Motion carries.
All right, thank you.
Okay,
I
thank
believe
you, Adam.
that's all I've got, unless you guys have anything for me. All right, I'll turn it over to Ryan.
Okay, thank you.
Thanks, sir.
Thank you, guys.
Road and Bridge Superintendent Ryan Durst, Department Update. Good morning, Ryan.
Good morning. How's everyone doing?
Good.
Um, got one motion, just the top page of
Okay.
everyone. This is an agreement with KDOT. This is, dealing with the B2 bridge over there on the Olivet Road. And this is just the agreement, for some of the engineering inspection services, that we need to get signed, and then I believe here, towards the end of the month is when that's supposed to go to bid, on that bridge out there.
Okay. Wade, have you seen this agreement, or if you need to do that, I don't know.
Which one?
We didn't send it to him. I mean, this is
Bridge agreement.
agreement that we deal with
I mean,
on every
I'm sure
every
it's
funded
a
project that is a
standard
requirement of the
agreement.
state.
Yeah, these are.
It's just a standard deal, isn't it?
Yeah, I mean, in order to get the funding and for the process to keep going, it's,
Probably shouldn't ask that, but it's just.
no, that's fine.
pretty good, you know.
Yeah, I've seen, not that exact one, but it's
Okay,
the same as the others unless they change
okay.
update some forms.
Okay, well, I would make a motion to approve and sign the KDOT form agreement for federal aid construction engineering inspection services by consultant for project number 16C-5348-01, federal aid of System Bridge Program to replace County Bridge 2 located 5.5 miles east and 0.8 miles north of Lebo, Kansas. Do I have a second?
Second.
Barker seconded. Any further discussion?
Is the, consultant that's inspecting these, who is it?
Cook Flat, maybe who's selected on that.
They got a start date, tentative?
We won't know that until construction takes place. I think the early start date on that is, March 1st, and late start dates like May 1st. To be completed this year, just kind of look for the late start date on that.
Are you gonna try to make a bypass around there, or are you gonna close the bridge?
That road will probably close down, yeah. The side structure channel that it is.
Okay. Any further discussion? All in favor say aye. Aye. Motion carries.
Thank you. And next, I'd like to request an executive session, for 15 minutes for the board, myself and Wade, for non-elected personnel and job performance.
Ask for a motion to enter into executive session for 15 minutes to include each of the commissioners, Road and Bridge Superintendent Ryan Durst, and County Councilor Wade Bowie II, to discuss matters of non-elected personnel regarding job performance under Kansas Open Meetings Act, KSA 75-4319B1.
So moved.
Then moved by Barker and seconded by Peterson. Any further discussion? All in favor say aye. Aye. Motion carries. We'll go in at 9:50.
Perhaps you can explain that start time just to hear.
Okay. Why don't we make it 10 o'clock, 10:01?
10 o'clock.
Okay. We'll enter in at 10 o'clock. Take a break now.
He said he could wait for me. He did say that, I did. And a little bit did pass.
That's right. no action taken because the previous executive session.
That is all I have for today.
When we were going through warrants and stuff, last week, we had a question, I guess, concerning a couple tickets that had to do with the landfill, you know, one had to do with disposal of a refrigerator from the sheriff's department, and, there's a ticket charge for that, and then the other was C&D. Anyway, we were just questioning, do we bill other departments, the inter-county departments, you know, for disposing at the landfill, or is that waived, or?
I mean, I would say if you guys make an action that it's waived, I mean, it would be waived, but I would have to see the exact.
But if not, if another department actually uses the landfill, they're charged for it. I guess that's the question.
Yeah, I would have to ask on that. I mean, I'm trying to think on.
It's a little thing.
Yeah.
We're charged.
Okay, then I would say that, yeah, we've charged, I mean.
So, I don't know where to go with that, except, if we've done it in the past, do we keep doing it, or do we wanna change it, or it's probably that way for a reason, so.
Well, I mean, it's just, I don't know that it makes a big difference one way or another, other than, you know, you just be taking whatever the cost was, you know, just directly from the landfill, and not reimbursing that to the landfill. I mean, I don't know that it matters one way or the other. I mean, it's still the same dollars coming from same place.
Well,
I think that first ticket was like $5.
it was like $5.
For
It was,
dispose of a refrigerator. The second one was a C&D ticket for $5 too.
that it just raised the question, you know, what is the policy?
Yeah, I don't know that there's a specific policy in place.
I don't know. I know I asked years ago, not
Yeah.
related to them asking now, but years ago I asked when Wayne was here, because when we have to get rid of election staff, we have to go bury it.
Yeah.
And, everybody has to pay.
Yeah, I don't know that it makes a hill beans one way or the other. I mean.
The only thing I don't know that it matters, but it'd be like documentation, like when we waive landfills to tear down a building or whatever, it would be, okay, this product went in there free of charge. It would be kind of a.
I mean, we just got to be able to track the tonnages and what's coming in there. I mean, as far as if something's being paid or waived or whatever, that doesn't matter for that side out there. It's the tracking for the reporting to the state that, I mean, we've got to have. So, I mean, they're gonna have to write tickets up on it no matter what. But, I mean, whether you guys say that if it's county-related business from inter-office stuff and we're not gonna charge them or whatever, I mean, I don't know that would matter on that side of it. It's just that we have to track what's coming in out there.
Well, what we saw, the amounts were so little, it really doesn't matter. Like I said, it was just a question of policy or whatever.
Yeah,
I guess
yeah.
unless we decide to change it, I guess just leave it.
Yeah. All I thought was just that it documents what products are going in the landfill that we're not being paid for. You know, I don't think that'd really be a concern of any abuse there, really, that stuff's getting taken there under the name of a county agency. Right. That'd be, maybe that's a stretch, okay, just a thought that crossed my mind, you know.
Okay.
Good. Something
All
to
right.
consider.
Thanks, sir.
Yep, you guys have a good week.
Okay, thank you. Well, that's the bottom of our agenda. Have other items we want to work on?
On that one document that I signed,
Yes.
was I here on,
You were here on that day, but you weren't here,
for the
a
discussion.
copy of that.
Okay,
So Heidi can
Yeah.
put up a new signature
Okay.
sheet, and then you can always sign.
okay, very good, very
That
good.
should be her.
Thank you.
You don't think you can just draw a line through the signature?
I don't know.
That's what I could have done.
I don't know.
White out. White out.
Do we have any questions for Richard concerning this document?
Was he wanting to talk about this? He said something about maybe loaning him if we had a minute.
I can get
Yeah,
it.
we'd asked him, hadn't we?
Yeah, might as well bring him in, if he has any comments. Like we have earned over $3 million in interest last year.
That's on the plus side.
Somebody's dead. Altercation at the City Hall in Lawrence.
You what?
This morning, City Hall, there was an altercation of some sort. City Hall is closed and at least
In Lawrence.
the IDW says one person is dead following an altercation at the Lawrence City Hall.
Wow.
You pay your taxes.
Maybe somebody was mad about Maduro or whatever his name is. That was, yeah.
Yeah, well.
Whether people like it or not, our security downstairs is a deterrent to that type of behavior because, you know, the presence and experience that they provide is a safety net for everybody.
First thing everybody sees when they come in the door,
That's right.
you know.
a number of people will walk in, they'll see that, they'll turn right around, walk back out, and probably dispose of whatever it is that they were gonna bring in.
Shouldn't have been bringing in,
You go to Osage County, you can't go into the courthouse without going through security. I mean, it's a security facility all the way around.
Yeah, Lyon County's the same way, you go through metal detector and everything.
I need home.
Good morning.
We don't know.
Well, we're just, maybe you wanted to speak a little bit of this handout. And some of that.
Yeah, but
More
you
a
wanna-
little bit, thought maybe you wanted to.
All right, that's what I'm supposed to give you guys at the beginning of every year.
Okay.
Talks about the interest, like, and it shows from all the different sources. So each bank is listed on the front and back papers that are behind the cover sheet. And so if you can see how much the balance is in the banks and how much interest it earns. And it says quarterly interest, but that's on the year. You can check the dates up above, 120 to 12/31. They use 120 because somewhere before that is when December gets added for 2024. And so I didn't want to include that. And so that's why I said approximately 50 grand in checking and investments is not yet credited.
So these, go ahead.
I was gonna say, and so that shows you how much money we have at the assorted banks. So
Right.
Central has X, Citizens has a little bit.
Okay.
But back to Central, that if you're looking at it, the 001 account. It's on the front, yeah. And so anyway, that's what is at their trust department. So that's not actually in Central. The trust department for Raymond James, so that's where that 36 is, and that's where the disbursement distribution money's coming from, that goes to the hospital, to the fire department, library, all that fun stuff. That's where all that excess is. I added 24 million to that this last December. And so then when it comes time to make distributions here in a couple weeks, I'll answer it back and send it away.
These investment accounts, those are actually CD numbers?
Yeah, some of them were cash, some of them aren't. Obviously, the ones that have a balance are the ones that has.
Okay. And when those mature, do you go out and rebid them and solicit quotes for them? See what the best deal you can get for them? Okay, perfect.
Yeah, and then the cash or transferring assets, that one down there on the front page. It says $237,000. That's cash we received on the last day of the year, plus the cash we have in the bank. So cash and checks that haven't actually been deposited yet,
Okay.
so
But they're part of 2025, even though they haven't been deposited.
well, they have been, but they just haven't showed up in the system
Yeah.
because it's the last day of the year, so
Yeah,
it's
they
just the
did.
way the stupid banking works.
Right, but they didn't get deposited on the 31st, they got deposited this year, but they're actually part of 25 business, correct?
They went in on the 31st.
Oh, they did, okay. Okay.
But it just takes another day, because it gets stuck in the sweep account, and then checks to clear and all that fun stuff.
Okay.
Jersey did an outstanding job investing in 2025.
Yeah, it's not bad. Anytime you can make $3 million,
Yeah.
it's okay.
It is. It's better than losing $3 million.
Yes.
Sorry. Yeah.
Pretty good.
Most of it was around 4. But again, we just collected 33 million over the last 2 weeks of the year around Christmas. You know, for all the taxes, and that's what got sent. Part went to stayed in town, and part of it went to Central's Trust. to Raymond James.
Okay.
Any other cursing? Discussing?
Nope.
Okay.
Very good.
Okay.
All right.
Appreciate you coming in.
Thank you very much.
Thank you.
Okay.
Nothing else as far as I know.
So do we wanna touch any more on the salary schedule, or we need to wait another week for that, or?
I'd like to do another week on it. Do a little more investigation
Okay.
and see, and figure out the total cost this is gonna do.
Okay.
But I'm just going, so.
That's fine.
We're okay on that, aren't we?
Yeah.
Wait another week.
Yeah.
Okay.
I can give you a little information on that if I was placing people onto the chart. So some people, the cents might have been like real close to getting them on the chart, so it would have been a small increase to get them onto the new 15 step. Then there were some other people where the census was a little bit more, so it's not everyone's not gonna get the same amount to get placed on the chart, if that makes sense. Because of where they were on the old chart, and then how it kind of comes down to average it out, you know, to keep the dollar amounts. So that's just FYI.
Okay. So Wade, did you have roundtable for us?
I don't really have anything for today. Some point in time at the beginning of the year, maybe to identify, so it's on your radar, what your focus areas are, what you want to see happen. So for example, with, I would assume one of the items is to get the airport property replatted and ready to go. The north property, to figure out what you want to do with it, one way or another.
We signed a 6-month lease for that starting in
In May.
September.
November. So in May is when that one will come.
Renewal or expire or whatever.
Right. So just beginning of the year is always a good place to start and kind of have in the back of your head the things you want to focus on. I know mid-year or at some point last year you identified, you know, the hospital properties and the Maryville's property to get that taken care of and addressed and sold by the end of the year, so you met those marks. My opinion is having that discussion now so you can identify where you want to focus your time and attention. At one point in time, prior to at least 3 of you becoming board members, there's a green book somewhere that has a number of different properties that are owned by the county that are irregular, is what I'll call them, and to potentially try to get those back on the tax rolls, because they are properties that are either near or adjacent to other properties that they're small little triangles or small little pieces that by themselves probably won't generate much in the way of going to a sale, and there's a reason why they're irregular and where they are. The conversation previously was to potentially see if there was a way to see if any adjacent landowners might have interest in them for whatever it might, the value might be, to then carve them into their land, and I don't know if the three of you, have access to that. I think you guys know what I'm talking about.
Yeah, I imagine it's back here in my file cabinet.
There was one of the documents that came by and I'd written it down last month, just over here. The county owns 944 acres. So I was wondering what all that was. We have a large parcel of land with the north property and with the airport, but if, like what he's relaying to, yeah, I'm all for.
Yeah.
We can get
Smaller
back on,
segments and get them.
get them back on the tax rolls.
This was a list that had basically a green binder.
And then it had,
Maps and
it had maps in it.
Pictures or
Every
something.
piece of property owned by the county.
Yeah, I don't know where I start looking for it, but I'm pretty sure it's in my file cabinet.
It's probably in here.
They're over there, you've got them maybe in your drawers, you might have put them in your drawers. Yeah, that's one of them, I think.
That's it?
That's it.
Yep, we had that put together. So it was put together all county property, but you'll see some of the property is just irregular pieces of property that.
I'm guessing it probably needs to be updated, because
Yeah.
this is Sunset Manor here, and that's gone.
I'm not seeing it. Oh, then it is
Yep, that's it.
One of the other things to think about right now in the beginning of the year is probably as good a time as any. I've had a number of citizens stop me asking if the audio could be updated and modified. And what that means is you guys would need to approve it, but maybe to drop some microphones down, 3 microphones that get closer. A lot of people can hear paper rustling, but if there's paper rustling and somebody talking, then the quality of the audio is probably not what it should be. And if you're gonna have this forum or format, you probably need to have it to where you can pick up on things. That's just a suggestion. And then the other thing is, and I've talked a little bit to Brad about maybe changing or altering the way that we are able to present things. I think we spend a lot of time spinning our wheels trying to get things connected, and valuable time is lost. And I think it can be easily remedied with either the combination of a drop cord with a HDMI port, and or I have little dongles that I connect to my laptop and the TV in the courtroom, so I can sit at the council table and broadcast stuff to that television, and I do that with presentation of videos, paper exhibits, and it's in front of a jury, and the format is clean. Here, the disruption and people bringing their own equipment and then trying to connect just, I think, creates unnecessary delays, and then you sit and wait, and then you get behind on your agenda, not because people aren't prepared, they just can't connect to the technology. You have a TV here that you should be able to do that automatically.
Yeah.
Just my opinion.
I guess my thought about the audio video is that at this point, I'm more concerned about if we could get the audio to match the videotape as far as timing. You know, and in my thought, I mean, as far as hearing what's said here, I'd like for it to be equivalent as somebody sitting in the audience. I don't know that I need a microphone right here in front of me for everything I say or every time I cough or whatever. That's just my personal opinion. But we're way out of sync on I haven't watched them, a couple of them for a while now. The guys were like 30 seconds or more, a minute at sometimes out of sync between the audio and the visual. It makes it really annoying to try to watch them, because sometimes you can't tell for sure who's talking, but,
I don't think you need to have microphones sitting exactly in front of you, just having a microphone where it drops down just a little closer to the
get a little
ground
better
is probably-
reception.
Yeah, is more helpful, because right now the microphones are up on the ceiling and picking anything up.
Right.
People, if somebody's talking loud enough, it's probably not an issue, but when you have papers rustling or who knows what's going on, that's one of the common things that I've heard, is it makes it very difficult to separate that sound.
Right.
And then, I'm not sure which one of these, one of them works better than the other, but, to have audio at least picked up in the entire room, going from this side all the way to that side, because you have members of the public who at times have something to say, and their audio's not always as clear as what it should be either.
It would seem that camera works and this one doesn't, I assume, which, I've never seen it's not a panoramic view of the audience, and I'm not sure it has to be,
I think that viewpoint, as long as you have the audio that's picked up, that's more than what a lot of other places have, because some places still don't have anything.
Right. Have you heard anything yet on the sheriff's deed on Marie Bells for that correction?
Sheriff signed it, it got sent back, it had to go through that process, so that it's probably in transit. But I think it's just a matter of time. Once that makes it back, it's likely gonna be sent straight to the register of deeds, so it can be filed.
Okay. Well, I just, the title company, I told them when they received word of it to let me know, and I'd come get the check. I went and signed the closing, but we still don't have the check, waiting on the title to be perfected.
Yep.
So that's all I was wondering, if it knew where that process was.
I can check with the register of deeds office and see if they've received anything.
Because I'm sure they've got the check down there from the buyers.
Yeah, they were gonna hold the money in escrow
Yeah.
until that was satisfied.
Yeah, okay. I just hadn't heard any more about it, so.
I was giving the holidays a little time to catch up. My anticipation is that was, and the mail doesn't always run as quickly because of the volume at that time.
Right.
So outside of that, that was the only things that I had.
Okay. Bob?
I was just thinking the other day when we were going through checks and vouchers, that we've been paying for some physicals. I know it's not a lot of money and everything, and it may be totally way off base, but is there any way we could coordinate with our doctor or PA that we have with the jail to administer those physicals if they're on site? And save a little bit of money?
Yeah. I don't know.
Good immediate question? I don't know where to go, but it seems to me if they're here and they're not servicing anybody, they give a truck drivers a physical there real quick for them, and, you know.
Yeah, they'd have to be certified.
They have to be
Certified, but, I mean,
Yeah, right.
we're paying good money there for that service, and we might as well put it to the most use we can get out of it.
We probably need to start with the sheriff, see
Yeah,
what
yeah,
the contract is that they sign for
Sure.
the hospital, cause
Okay,
I don't know if it would,
yeah.
I remember reviewing that and I thought it was inmate specific.
And they, well, see, and that's what I'm asking.
Yeah.
Go ahead.
We
We just have to
checking into
revisit it.
that, cause it's $150, $200 a lot of times.
You know, when we're having to do that, when they renew their driver's licenses, or whenever we have somebody that comes in that needs a physical, that's an employee, that might
Yeah,
save a little money.
okay,
That's all I've got.
okay. Mr. Peterson?
I really don't have anything, except I was thinking back to, you mentioned the warrants. That mileage thing from from Mercy Management, they had a vendor that had that
Yeah.
high mileage. I just wondering if we ever got a
The $7,500 for
Yeah.
mileage.
explanation on that yet. I know we're fresh back from the holidays, but anyway, that, I was just wondering about that.
That was last week, wasn't it? Or, I think.
That entered
29.
last week.
Or 29. Oh, yeah, yeah, yeah.
And we have Amelia maybe come up next Monday and see if she's got information on that.
That was Amber.
Or Amber, I'm sorry.
Yeah. I knew that's what you meant, that's what you said.
Yeah, hopefully by next week, we just have an explanation on that.
Yeah, yeah.
And do we know, is Saban gonna be presenting the water study anytime soon, or have we heard anything back?
Let's see, I think I have him on the agenda. Yes, he'll be here next Monday at 9 AM.
Okay. Other than that, I don't have any.
Okay. Mike?
Heidi informed me that she got her preliminary drawings for the airport rack on the potential plating. And I'm gonna visit with her a little bit and, see how much of it, where we wanna go with it. And then she's gonna bring it to us next week with Carl and Ginny, and we're gonna try to get that forward like we talked about originally, and get this thing going with plating the airport for industrial sites. So, other than that, I don't have too much to
That'd
do.
be good to get the ball rolling on that, I appreciate it, Mike.
Let's get her going and make some sites available for some
Yeah.
growth.
Yeah, got some things laid out and more ready.
Yes. So, other than that, that's about all I got today.
Steve?
The only thing I've got is, Wade brought something up about the north property. I guess I'd like to see us, pursue that a little more as far as getting an acreage set, maybe an appraisal done, and just see where we stand on that, and, because right now I don't think we have an exact acreage on,
We had the thought process and Mike's
Right.
kinda drawn, I thought, but.
and it's just kind of become stagnant, but I would like to see that pursued and try to get an exact acreage of what we're looking at to move, and I assume we would get an appraisal, just to see where we stood on that. I mean, that's just a guess, I don't know anything about it.
There's some interest out there for that property.
Well, and I think,
Yeah, a lot of people think that it's, that it's too much or whatever. I think there's people who'd be interested.
yeah, I do, and that's the only thing I've got. I'd just like to see us pursue that a little bit.
Back on the tax roll.
And get that part of it taken care of.
Yeah, yeah.
But
I like
that's
that
all I've
idea,
got.
Steve.
We got until May when the lease runs out.
Yeah.
Right, but we wanna make sure that
Yep.
that we give him ample time
Right.
I certainly don't wanna blindside him by any means. I don't mean that at all. I just,
Keep him in the loop.
yeah, keep him in the
Yep.
loop and,
Figure out whether we wanna rent it out again or sell it
or
whatever
whatever,
we need to
but
do
we just need an exact acreage on what we've got,
potentially to get rid of.
right, and some kind of
If I remember right, kind of the last thought kind of was go over to the east of that hedgerow and then go, you know, now how far north we go, whether we go down and include the lagoon, that gives some buffer space on the north side of the house, and kind of over to that draw and follow that draw.
I thought we showed that all to Saban to draw out for us at
He
one
was
time.
supposed to brought us some preliminary plats back and
Like I say, it's been,
And maybe he's got it. I don't know.
maybe he's got it, but it's just something that, I think we need to pursue and keep it going.
Yeah, yeah,
Bring that up to him next week when he's here.
Yeah.
yeah, okay, that'd be great. Yeah.
You might not also ask Jenny about that property, because I know she's been doing some background investigation regarding that property, and if it were gonna turn into something else, what it would take, and
Okay.
I know she's talked with some other counties and what they did to potentially develop their, a parcel like that. Just so you have all the options available for you when you make decisions.
Yeah, yeah.
That's all I've got, Wade.
Yeah, that's, I don't know quite where we would, let's say we, just an example, we sold the house out, this tract we talked about, different lines and different areas, but whatever, we sell the house area off. You know, I can see like the airport deal, that's pretty level land, that's great, we get that platted off. I'm not sure where we go on that tract up there, a lot of that ground's uneven. How would you pursue that until you know what the use is for somebody, you know? I mean, they may need a whole bunch of dirt work done, you put streets in or something and they get torn out. You know, I'm just thinking out loud here, I don't know,
think
guys.
the first thing that we really need to think about that, to have it shovel ready for that, is we need water that'll be available for it, and
Right.
we're looking at sewer, because right now, I think people would shy away from it because they don't have access to that yet.
Yes,
Well, and that's
you're
right, because there's no infrastructure there at all.
Right.
I mean, it's,
And with gas, you know, if we had that going, somehow working towards it, that would make that very appealing.
Yeah, yeah, exactly. 'Cause
no, I
those are-
agree.
And, you know, even for some things, just some figures as to what power availability is, and, you know, that's something we could find out. Because a lot of different projects would require different amounts of electricity.
and water.
And water.
And I think right now, though, with our water feasibility study that we've done, and talking with Jenny, it might be time to do something there and start writing the grants to get it taken care of and move on with it. No matter we don't have anything there, the water would be ready for it.
Yeah.
Well, and that's such a big important part of that whole thing, whether you're talking sewer or whatever, water is all
And
important.
it's gonna be a pretty good chunk of money to do, so we might as well get it out ahead of with the grant writing for it, and the agencies that we can get funds from.
That's all I got.
I didn't have anything else that we hadn't already touched on, Angie?
The only thing I have is, so, being it's a new year, the next meeting, you guys will appoint a new chairman or vice chairman if you're wanting, or reappoint, whichever you're wanting to do. So keep that on your radar.
We
And
do
then,
that at the beginning of the meeting, don't we, Angie?
yeah, you approve the minutes, and then you go right into making your appointments or
Okay.
changes or whatever, or reappointing if you want to do it that way. And then, let's see. If there's any KAC trainings that you guys are gonna be interested in, I can print off, you can take a look, or if you're looking, you want to sign up for something, I'll be happy to get you scheduled for that.
What was that, Angie? I'm sorry.
KAC
Oh,
training,
okay.
if there's any out there that interests you, just let me know, I can print off whatever you need. And then we'll have the gap waiver resolution next week after you make that appointment too, on who is gonna be, that way it's the chairman and vice chairman for next year. That's the resolution that you approve every year for governmental accounting principles, so.
Okay.
And I think that's all I have today. We're working on year end now, closing out the year, so, and I've got two new people, so I'm,
In the process, huh?
yeah.
Angie, is there any way that we could get these updated? I mean, it'll have to be for next week, but the current properties
Yeah.
that we have.
I mean, I'll be happy to do it, or
Well, I don't know
Wade
who
tells
would
me
be
what
in
to
charge
do, I'll
of
do
that,
it.
but You guys are saying that some of the properties that are on here are already gone.
Well, since that's on here,
If we
it's
can get
gone.
these updated.
I had them put together by the appraiser's office, so I can see if I can take one of them. And try to give you-
No, that's fine.
Do we wanna, yeah, or would it be easier for them just to take some sheets out of here or something and update these booklets rather than making all new ones, or?
Yeah, if you just hand me the ones that you have.
Yeah.
This is something that the appraiser's office graciously did at my request.
What is it with four of them? I don't know. Is it bottom one? They all feel off together.
We're gonna have to cut the block to get it out.
One time we had 5, so that's,
Maybe they could just go through those and revitalize them and amend them.
We'll get them updated. In fact, whoever's this was, where these tabs are, looks like some of these irregular pieces of property, so you'll just hand this one around, I mean, look at where that property is and what do you do with that?
Lakefront.
I'm gonna cut off too.
Pardon me?
That's the salary.
Oh, okay.
I had a printout ready for you today, if you want to
thank
take
you.
that with you and make notes or write on it or whatever.
Yeah, you'll be surprised to see what the county owns and what the rhyme or reason is. There's some that are
Something happened with all.
like that one right there.
Some low level
Tax
pieces.
sale related, or?
You got me. It's interesting.
So for some of those really small ones or whatever, would we need to be looking at, just for the purposes of getting them back on the tax roll, not maybe much value there?
There was a process, and I'd have to go back through and
That's all my question was if we would take care of the paperwork to get it to somebody, I guess, because, they're not gonna pay for a bunch of fees to get a 5-foot square,
yeah.
Or some of them are really small, if I recall right.
If nothing less, I mean, it would clean up everything.
Yeah, right, Mark.
And insurance wise, we wouldn't have to insure them anymore, we'd go on someone else and say,
Yeah.
Sony, that one too.
Yeah, because there were several of them were really
Questionable.
Jacobs Creek stuff, if I remember right, and different little spots around town, and, that's my recollection of it.
Then if you flip over onto the back, it'll give you the legal, where it's, you see what I mean, they're just out in the middle of nowhere.
It's crazy. Well, if we can get them updated, then definitely look at them.
Yeah.
Has this one been redone since you sent the email out to us again?
Yeah, that's the one I sent you an email. My export worked, and then instead of sorting, I just, left it the way it was and put the new what the closest step would be for them to step on the
Okay,
charge.
'cause I was under the idea that was 106,000. I got mine on the desk. Yes.
Email. The email I sent shows 102 also.
Did it? Okay.
Yeah.
All right.
I'll just see, look at mine again, I may.
Yeah, let me know.
They were really little when I did mine, so I may have had my no line glasses in the wrong place.
Okay. Well, yeah, let me know if not, because then I'm gonna have to.
That's easy to do.
But I looked at my sent folder and that's the same, so. And I went over them, and I even went through in the payroll system and checked to make sure this is what they made, this is the step.
Well, what's everybody think? We got anything else we need to address? If not, I guess we'll adjourn at 11:02. AM meeting, wow.